My husband and I went hungry a lot of the times just to make sure our daughter had food and stayed healthy and maintained a sense of normalcy.
I had to choose between paying for my prescriptions, paying outstanding medical bills, or going grocery shopping.
I could be in class sometimes, just like not even thinking about what the teacher is talking about, wondering what's going on, just because I'm so hungry and I need some food.
There is a pervasive feeling of shame. I shouldn't be in this position.
These quotes represent some of the experiences of people in our community and our campus who are food insecure. We are presenting to you as members of the EAT Initiative at Emporia State University. The EAT Initiative stands for Emporia at the Table, Ending Hunger in Our Community. The EAT Initiative is a collaborative and interdisciplinary effort to combat food insecurity at Emporia State University and in the greater Emporia community. I'm Christina Wonkum, a senior communication major and intern with the EAT Initiative. With me are Delaney Dold and Kay McGregor, also senior communication majors and interns, and Dr. Jasmine Linneberry, an assistant professor of communication and one of the co-founders and directors of the EAT Initiative. The goal of this presentation is to give you a deeper understanding of what food insecurity is. We are also here to share about some solutions that we have implemented on our campus and challenges that we have encountered along the way. We hope to inspire you and provide you with ways to think about how you might take action in your own community. We have offered 3 breakout activities along the way and encourage you to pause the presentation and take time to reflect on your own or with others. So first, what is food insecurity? Food insecurity generally refers to a lack of consistent access to sufficient, safe, and nutritious food. However, food insecurity is not just a technical problem, but rather an adaptive challenge, a difficult issue with no one simple, easy fix or solution. Food insecurity is also stigmatized, as one of the quotes at the beginning of this presentation illustrated, which can keep many from seeking out or accepting help. Despite assumptions that hunger happens elsewhere, food insecurity is a widespread issue in the United States. According to data collected by Feeding America's Map, the Meal Gap, 15 million American households were considered food insecure as of 2017. That means more than 1 in every 10 households was food insecure. Food insecurity is particularly prevalent in rural areas. A 2018 USDA report found that approximately 79% of counties with the highest hunger rates were in rural areas. This issue also specifically impacts residents of Kansas. Feeding America indicates that 370,860 people in Kansas are struggling with food insecurity, and 130,210 of those are children. While those are broad trends, we also want to share with you what food insecurity looks like in our county and community, the context for which our project took place. Emporia State University is situated in the city of Emporia, which is in Lyon County. If you aren't familiar with the area, it's on the edge of the Flint Hills, known for back roads, biking, and disc golf. According to the data collected by Feeding America's Map, the Meal Gap, 13.5% of Lyon County residents were considered food insecure as of 2017, which is higher than both the state and the national rates of food insecurity. The same source indicates that 19.1% of children in Lyon County were considered food insecure as of 2017. Food insecure children may experience short-term and long-term health and economic consequences. From our research, we also understood the specific challenges facing the Emporia community when it comes to food insecurity. And there's a large food desert located on the south side of town, where there's a lack of grocery stores and access to food. Now I will turn it over to Kay McGregor to talk about how food insecurity impacts college students.
We also know food insecurity is an issue on our campus and among college students generally. The Hope Center, which runs the nation's largest basic needs assessment among college students, has been studying this issue for the last 5 years. According to their latest Real College survey, approximately 39% of college students were considered food insecure in 2019. Many food insecure college students are likely to already be working, receiving financial aid, and/or enrolled in meal plans. This year, as a result of the EAT initiative, we convinced our campus to participate in the Hope Center's Real College survey for the first time, one of only 2 campuses in Kansas to do so. According to the survey results, 41% of ESU students had experienced food insecurity in the 30 days prior to the survey. ESU actually had one of the earlier campus food pantries. Since opening in November of 2014, ESU's Corky's Cupboard has served over 950 students and distributed over 57,000 items. And the numbers served were already on the rise prior to COVID-19. Between August and October 2019 alone, there were 460 visits to Corky's Cupboard, and over 3,500 items had been given out. Student hunger can have a significant impact on student learning as well as retention and completion. To give you a clearer picture of what food insecurity might look like for students, we'd like to share a few composite narratives that reflect what some students might experience. I am working 2 jobs to support myself through college and be able to buy necessities. I am trying my best to keep up with all aspects of my life. However, my social life has taken a big blow. My friends are always inviting me to hang out with them, but I always have to work. No matter what I tell them, they think that I'm not putting any effort towards our friendship, and now my friend group is mad at me. I would tell them what's going on, but I am ashamed. My parents are not helping me pay for college because they want me to do it on my own. They have always placed high expectations on me, and I'm trying my best. However, my lack of food caused me not to be able to focus during class, and my GPA dropped from a 4.0 my freshman year when I had a meal plan to a 2.8 my sophomore year. My parents were so disappointed that they are pulling me out of school next year. I am part of the LGBTQ+ community and am food insecure. I'm afraid to ask for help. I can't ask my family. I'm embarrassed to talk to my friends. I'm embarrassed to be seen walking out of Corky's Cupboard, and I'm definitely afraid to walk into one of the local church pantries. And I'm afraid that I will not be accepted or my community will be seen as weak if I get help. So I don't. All I have to eat this week is 3 packs of ramen and a couple of granola bars. I am so exhausted that it is hard to go to class. I am always lethargic, and the people around me have noticed how irritable I am. In this first breakout activity, we encourage you to use this opportunity to think about what food insecurity looks like in your community. Consider taking out a piece of paper and trying to create a stakeholder map for your campus and/or your community. As we hope you've gathered, food insecurity is an important and pressing issue in our community and on our campuses. But what exactly is the EAT initiative and what are we trying to do about it? I'm going to turn it over to Delaney Dold to talk more about our efforts.
The EAT initiative, which was founded this fall, represents a collective effort to end hunger in our community. Our hope with this initiative is to establish partnerships across ESU's campus and within the Emporia community, because we believe together we can make a greater impact. This initiative was started with the support of a high-impact learning grant from ESU. The EAT team includes a variety of faculty, staff, and students, as well as other partners. The initiative was co-founded and is directed by Dr. Jasmine Linneberry, who you've already been introduced to, Dr. Rebecca Rodriguez-Carey, an assistant professor in the Department of Sociology, Anthropology, and Crime and Delinquency Studies, and Blythe Eddy, who serves as the Director of Student Activities and Community Service for the Center for Student Involvement. She also oversees Corky's Cupboard. Currently, we have 11 collaborating faculty across at least 8 departments. Example departments include art, economics, English, geography, library and archives, and the Teachers College. We have students who are taking on leadership roles in this initiative. For example, the three of us who are students that are presenting were all in Dr. Linneberry's group leadership class in the fall. We each played different roles along with our peers in helping launch the initiative as part of the class, including engaging in marketing, event planning, conducting original research, and facilitating dialogues. This semester, we've continued on as interns with the initiative. We have also established a variety of partnerships with campus and community groups. Examples on campus include ASG, Community Hornets and Corky's Cupboard, diversity student programs, the Student Wellness Center, and the University Library and Archives. Examples of community partners include Healthier Lyon County, the Lyon County Food and Farm Council, Salvation Army, the Emporia Public Library, as well as some others. Our initial goals have been to increase understanding of the problem and causes of food insecurity locally, and prompt dialogues amongst various stakeholders to identify solutions and take action to end hunger on our campus and in the greater Emporia community. To accomplish these goals, the initiative involves three primary components: education, research, and action. In terms of education, we are bringing conversations around food insecurity into our classrooms using high-impact learning practices. Multiple classes across the university have adopted food insecurity as a theme for the class or for an assignment for fall 2019 and/or spring 2020. For example, those of us in the group leadership class were actively involved as leaders in the initiative, contributing in various ways to both research and action. Several of us have continued as interns with Dr. Linneberry this semester. Dr. Rodriguez-Carey's students have engaged in photo-based projects to document what food insecurity looks like and engage in discussions about how it intersects with issues of gender, race, class, and others. These photo projects have been displayed as part of campus and community exhibits. Our second component is research. We have been supporting and conducting research to increase knowledge about food insecurity. For example, we championed ESU campuses participating in the Hope Center's National Basic Needs Security Assessment discussed earlier. We've conducted more than 60 qualitative interviews to get a deeper understanding of the problem, both on campus and in the community, including interviews with people who are food insecure. Our third component is action. We have been seeking to facilitate dialogue among various community and campus stakeholders to identify solutions and take action to end hunger on our campus and in our community. Examples include, we have facilitated a community action workshop in November that covered more than 40 stakeholders to develop a community action plan to address hunger in our community. We have hosted exhibits to reduce stigma about food insecurity. We are also sponsoring speakers, documentary showings, and other events. For example, we've had 3 guest speakers in the fall and a presentation from a statewide nonprofit this spring. We also hosted a major event on World Food Day in the fall with booths from campus and community partners and showing the documentary A Place at the Table. In March, we had a number of different activities and events planned with partners for March to End Hunger. Unfortunately, many of the events in the second half of the month have had to be canceled or postponed due to the current COVID-19 crisis. We have had several successes to date, and we'd like to give you a few examples. We have helped reduce stigma and increase people's willingness to seek help. This is evidenced by students actually seeking out faculty members to ask for food when they need it. It is also evidenced by students reporting through reflections on public events and exhibits that they have come to recognize and name their own experiences of food insecurity and have learned that it's okay to ask for help. We have helped increase usage of and donations to our own campus food pantry. The university even decided to make the Day of Giving in the fall focus on Corky's Cupboard. Through our community action workshop, we have co-created an initial community action plan with priorities that we have been taking steps to put into action this spring. We have helped promote connections and knowledge sharing between campus and community services. Importantly, we have cultivated institutional buy-in. One of the biggest ways this has happened was when ESU's president, Allison Garrett, publicly signed the PUSH commitment, which stands for Presidents United to Solve Hunger. In October, she became one of more than 100 presidents worldwide who have signed on to this commitment to end hunger. We have been in continued conversations with her about the next steps for ESU that we hope to be able to share those with you soon. Now we would like to give you guys a moment to reflect. In this second breakout activity, we encourage you to use this opportunity to reflect on what it would look like to design a collaboration on your campus and in your community. These questions are meant to serve as a guide. So now that you know a little bit about what we have been doing, I'd like to turn it over to Dr. Jasmine Linneberry to tell you about some of the challenges we have encountered in our efforts to address hunger in our community and strategies we've been trying to employ to address them.
In starting this initiative, we've encountered several major challenges. We hope in sharing about them with you to help you learn from our experience and anticipate what you might encounter. If you are already working around food insecurity, then perhaps you've encountered these challenges as well and might find some of our strategies useful. These are certainly not the only challenges we've experienced, but some of the key ones we wanted to share with you. The first major challenge has been related to centering the voices of those who are food insecure and being inclusive of all stakeholders, particularly those who are often excluded. Because food insecurity is a stigmatized issue, people are hesitant to want to talk about it. Yet we know that the problem needs to be understood from the perspective of those who have had lived experience with it. Additionally, we know that individuals experience food insecurity differently, depending on their identities, and that those from minoritized groups experience higher rates of food insecurity. In our community, there's a large Hispanic and migrant population that local agencies have largely struggled to reach. Many of those working in local food assistance programs are white women, and few programs have employees or volunteers who speak Spanish. As a result, we have employed a number of strategies in trying to be more inclusive in our efforts. This has included engaging in critical reflection on our positionality, relationships, and the process from the beginning. This at times has meant having hard conversations about our failings and the ways that we've come up short. We have sought to reach out and build relationships with community organizations, such as Hispanics of Today and Tomorrow. We've also partnered with our university's diversity student program coordinator. We've also sought to create our flyers and other handouts, particularly when we're recruiting interview participants in both English and Spanish. We also recruited a team member and a volunteer to translate. Despite these strategies, this is something we continue to struggle with and remain attentive to in our ongoing efforts to do and be better. A second category of challenges we experienced has involved practical constraints and existing policies. Here are a few examples. In terms of money, EAT has had some funds from grants provided by the university, but there were a lot of restrictions on how and what the money can be spent on. As a strategy, this has required us to get creative with our spending, but also rely on partners who have fewer restrictions. Time has also been a factor. There are a lot of people who are working with EAT, and they all have different commitments outside of this initiative. Juggling schedules has been challenging at times. As a strategy, we've sought to try to be understanding of different schedules and commitments and flexible with one another. In cases where one person was overloaded, others have stepped in. NCAA regulations are another challenge. Student athletes that we've worked with have had to be careful about what donations they are taking. They could get in trouble if it looks like they're accepting a bribe, and we know that our student athletes experience food insecurity. As a strategy, our plans pre-COVID-19 had been to meet with coaches and others in the athletic department to talk about our findings related to student athletes and alternative ways to get athletes the help they need. We've also discussed pushing for policy change as a long-term solution. Confidentiality can be another challenge. Food insecurity is a sensitive and often stigmatized issue. Due to confidentiality policies, our partners could not directly give us names of those who are food insecure so that we could interview them for this project. This made finding those who are food insecure to interview and invite into the process challenging. A strategy that we have used is to have to rely on our partners to pass along messages and opportunities. We've also had unique experiences to come alongside partners, given their relationships with clients and the trust clients have had with them. For example, at a local soup kitchen, the director helped vouch for us to people who were present, which made people more willing to talk to us. There have also been concerns about liability. One thing we wanted to do from the get-go was utilize all the excess food from restaurants, bakeries, food distributors, and other organizations. But businesses are often hesitant to do this because they're afraid if someone gets sick from eating their food that they will be sued. A strategy that we've mobilized is to develop resources to educate local organizations about Good Samaritan laws, which actually protect business in these situations, and have been learning from other food rescue and recovery efforts. A third major challenge is one that we couldn't have really anticipated when we started out: the current COVID-19 pandemic. Because the university and now other businesses have shut down, this means students and community members who were at risk before now have even less access to resources. Additionally, others may now find themselves in need. Students and community members may also be dealing with sickness themselves, losing a job or at least hours, and maybe not even having a place to stay if they depended on student housing. Many of our events, actions, and research plans for the spring had to be canceled or postponed. In light of all this, we have tried to figure out how we can still be of use during this time. We have been sharing and compiling resources. We found that a lot of resource information was scattered, so we pulled it all together into a list of basic needs resources for students and advocated for the university to share about them on the university's COVID-19 page. We have also been partnering with others to distribute needed information. EAT partnered with others on a community website called Emporia Strong that has become a central location for information. EAT created and maintains the information about ongoing emergency relief and local organizations' needs. Lastly, we've tried to continue to remain flexible and responsive to emerging needs. As a third breakout activity, we would encourage you to pause here and reflect on the challenges that you might anticipate in working around food insecurity on your own campus and in your community. We encourage you to use these questions as a guide to think about how some of these issues might be reflected in your own efforts. To conclude, I'd like to toss it back to Kay.
Thank you for the opportunity to share with you today about the EAT initiative and our efforts to address hunger in our community. We know there is a need among our students and in our communities, especially right now, but there are ways working together that we can make a difference. We invite you today to visit our website at www.emporia.edu to learn more or to speak with one of us about how you can take action to end hunger in your community. Our contact information is at the end of the presentation. Even if launching a collaborative initiative feels beyond your grasp, there are still things you can do. Specifically, we'd like to invite everyone today to start by educating yourself and others about existing resources. If you don't already know the answers, try to find out if your campus has a food pantry. How about an emergency aid fund? Try to find out if there is a central place where people can find information about current community services. If you are a faculty member, share about these resources with your students. Consider a basic needs syllabus statement. If you are a student, share these resources with your peers. Post about them on social media. Tell your friends. Odds are you or someone you know needs them. Together, we can help end hunger.